Former Governor Jim McGreevey, Assemblyman Tim Eustace of the 38th District, and Ocean County Prosecutor Joseph Coronato were part of the Guarini Institute panel discussion on the heroin and opiate crisis sweeping the state of New Jersey.
I think that it's a misnomer when we say that we have a heroin problem, because it's what I call the synthetic storm. It's a fentanyl problem. And when you really drill down and really take a look at it, we're finding that it's a cocktail that these people are taking when they're taking this supposedly heroin. This is going to sound crazy. If it was just heroin, I don't think I'd have as many deaths in Ocean County. When we went back and took that and we continued to drill down on it, we saw that in 20 deaths in March, we took a 3-week period where there's 20 deaths, and 17 of those 20 deaths included fentanyl, meaning they had fentanyl in their system. The bottom line is fentanyl is a synthetic opioid. It's extremely powerful. There's about 35 to 40 different types of fentanyl. You have acetyl fentanyl, butyl fentanyl, and you can go into the latest, which is carfentanil, which is an elephant drug. And the elephant drug, which is this carfentanil, is about 10,000 times more powerful than morphine. Just a small granular in that packet will probably kill somebody. The bottom line is that I believe the storm, and I call it the synthetic storm, is fentanyl. It's there. And I think the numbers, I think that we're going to be probably in Ocean County somewhere around 180 deaths this year at the end of the year, unfortunately. Next year we'll be well into the 200s, and probably by 2018 we'll be into 300 people a year dying from the heroin or fentanyl.
I have to say, in a terrible way, thank God this is affecting white suburban kids, because we're finally paying attention to the heroin crisis in our country, not just our state. My kids are black. They sort of have missed it, thank God. But I've been in recovery for over 35 years, and I bring that experience to the legislature. And since I've been in the legislature, I have to tell you that the woman I went to the legislature with, her son died of a fentanyl overdose this spring. I have doctors tell me that fentanyl is not addictive. This is crazy, absolutely crazy. And heroin is the tip of the iceberg, as you say, Donnie, and the prosecutor said. Heroin's the tip of the iceberg. It's the fentanyl that's really the problem, the synthetics, that I don't think enough physicians understand enough about addiction to begin with. And we're at fault in the legislature for not doing some of the things about making sure doctors follow through and make sure people don't need certain drugs. And hopefully we're going to address that. Right now we're at, I think, a nexus where we can change things in the legislature about how doctors prescribe. Doctors do not want to be told what to prescribe, and I'm not just blaming them. They, of course, don't want to be told what to do. I wouldn't want to be told in my profession by a legislator who does not hold my degree how to run my practice. Many dentists, if you have your wisdom teeth, we spoke about this earlier, if you have your wisdom teeth pulled, you get a 30-day supply of OxyContin.
Yep.
You get a 30-day supply of Vicodin. When 3 days, I think, would do the trick. And that leads to the gateway. That leads to shopping in my medicine cabinet. That leads to high school kids making 20 to 40 bucks for a single Vicodin or a single Percocet. Now, all the states around us have a system where a doctor can look it up and see whether this person has prescriptions, whether this person has opioids out. We have a voluntary program. And I have to admit,
it's 9 months behind.
Yeah.
It's
and
9
I have to
months
admit,
behind.
I am vice chair of the health committee, and we can't get this thing.
Well, you need to be chair of the health committee, and our chair needs to be
The
thrown
chair
out
of the
of
health committee is
office.
not going to let it move because he's a physician, and I understand that. Maybe we need to find a better way to do that.
But when you're dealing with nearly half of all the individuals that have a heroin addiction, nearly half of them had a prescription drug problem.
Sort of a prescription.
And that's the issue here. I mean, you talk about states like New York that have e-scripts where the doctors are mandated to do this. These are the types of conversations that we should be having in the state of New Jersey. And you want to go even further, I think there should be certain issues like singular broken bone or their wisdom teeth being removed, that they should not be prescribing an opiate for it. They should not be.
There's an inability for the medical profession to monitor and regulate themselves. Then it's incumbent upon the state to do so. And we have a couple different options. We could do it through insurance coverage, because as we all know, insurance coverage impacts both pharmacological pricing, reimbursement, doctor's hours. So I think part of this is that the same way we have best practices for insurance reimbursement, on best practices on drug treatment, best practices on procedures dealing with osteoporosis, whatever. I think we have to have best practices dealing with these opiates, and as the prosecutor said, specifically synthetic opiates.
While the panel received questions from the public, it was a comment on bail reform and the punishment to low-level crimes that triggered a back and forth between Michael DeLeon, an anti-drug activist and documentarian, and McGreevey.
When it comes to these offenders, because maybe that's part of the stigma. They're too scared of being arrested for not even a crime, but they're suffering.
So many people's lives were saved by bars and handcuffs. Unfortunately, I don't agree with safe injection sites. I think.
Wait, Michael's going over the edge. Here we go. Here we go. By the way, I'm not. Not all of us agree entirely where Michael's at.
Nobody's going to jail for substance abuse. I mean, that's just not going to happen.
We send people to jail. Every county jail in New Jersey is full of people locked up for substance.
But all I'm saying is,
bought our
no, I
heroin on the
agree with,
street.
but I'm
We've
just
broken
saying is
into
that
houses, we've
treatment
broken
is
into cars. You have
But Michael, the
forfeiture
treatment,
money.
though, is important.
But Jim, listen, absolutely, but we're not giving treatment.
Well,
Our county jails don't have treatment.
That's
We don't
not-
treat.
that's not-
A couple of our county jails have a couple of tiers that are treating people.
Yeah.
We are not treating the tens of thousands of
no,
people.
I agree,
who are county
but I
jails.
think, just keep it in the eye. I just, the treatment is important, and so what I think what the governor has done with drug court, I know in Jersey City, what, Mayor Fulop has done, and what we're doing in Newark with Mayor Brock, and what we're doing in Patterson, what we're doing in Ocean County with Freeholder Kelly's leadership, is trying to provide treatment
I'm
for
agreeing with
people
that.
for.
I agree with that.
So all that I'm saying is that, treatment has to be a critical component.
Hudson County View, the eye of the community.